This is Dr. Kaveh Milani for our wellness lecture. In general, one of the major and very common cancers in the US today is colon cancer. Colon cancer has been a difficult illness to manage over the past decades. And only recently has the evidence and the availability of technology and appropriate number of screenings brought the screening to a point where we feel comfortable to be able to grasp what's going on and cause an overall decrease in mortality from colon cancer. Colon cancer is a disease that develops in the colon, in the large intestine. The causes are unknown, but partly genetic and partly environmental. So part of the things that we really can't do much about and things that basically we can do a lot about. In general, it is thought that healthy eating, high dietary intake, and the avoidance of high fatty food can help decrease the radicalization of elements and the rise of colon cancer. The colon cancer screenings really begin at the age of 50. And from the age of 50 to 75, the screening for colon cancer is basically about every 5 to 10 years. Now, most of the studies that were done on this issue have been done in academic settings where an adequate prep is given and there's adequate time for colonoscopy, and so the colon cancer screening has actually been under very ideal conditions. Those ideal conditions may not be replicable in the busy gastroenterology offices where basically the doctor has a number of hours to hammer out a number of tests, and so it may be more difficult to actually have that same level of consistent results. The current recommendations for screening is about every 10 years, unless you have a significant family history, at which time you begin years before that. Let's say, for example, someone has a history of colon cancer in their father when they're 50, well then the son or daughter should be screened at the age of 40, which is 10 years before that. If someone has colon cancer, then the risk for first-degree family relative actually goes up a fair amount, and the children progeny needs to be tested also adequately. Now, I've seen colon cancer in 35-year-olds, I've seen colon cancer in 38-year-olds, sometimes as kind of a benign like bleeding, but then when it's evaluated, it turns out to not be like a simple hemorrhoid or anything else, but actually colon cancer. And in the younger ages, oftentimes it is a little more aggressive and needs to be treated a little bit more differently. For the screening of colon cancer, the good news is that colon cancer screening under adequate conditions every 5 to 10 years with a colonoscopy is very, very good. That also can be managed by using a flexible sigmoidoscopy, which only goes up half the way and does a good look. But on the other side, it may miss colon cancer as early on the right side. And the past 2 decades, there has been a right shift in colon cancer, so the right side of the colon has been picking up more colon cancer actually. So the newest methodology available is a test that's called Cologuard, and that Cologuard is an amazing test in a sense that it does not require prep, does not require basically taking a day off from work, being knocked out, IV medication, and it does involve one simple thing. You have to produce a stool culture, a stool sample, and send it in, and it will be tested with multiple things, for blood, for immunological issues, and for early colon cancer genetically. And if it's positive, then you pursue with a colonoscopy. And that should decrease the number of colonoscopies that we do in a number of years by a significant amount, because that needs to be done only every third year, and every 3 years when it's clean, then basically you could go on to not have a colonoscopy done every 5 to 10 years. So this is a new advance in the system. Unfortunately, at this time, it is relatively easy to get with Medicare, and it's very difficult to get with the commercial insurance plans. But I think in a few years, the commercial insurance plans noticing the importance of this and how it could basically alleviate our cost should move to this test. And I anticipate that Cologuard is going to be available. And now it is actually recommended alongside colonoscopy as your A-level testing by the United States Preventive Task Force Services for colon cancer screening. So don't forget about the colon cancer screening. It's once every 10 years. Do not be shy. Go to the doctor, get it arranged, get it organized. I know there's multiple stages to this process, but I think people should recognize that it's an important testing to be done. You don't want to be caught behind this. I've lost personal friends to colon cancer, and I have a lot of patients below the age of 40 that have had colon cancer. And so basically there's good evidence that colon cancer needs to be screened for and taken very seriously, and the procrastination is just unfortunate and should not be done. So without any further ado, I do want to ask patients to follow up with their physicians for this particular testing for colon cancer. Thank you for your attention. This is Kaveh and Milani for the Wellness Lectures.
Hello, welcome to Virginia Medical Update Show. I'm your host Mahnoush Mahmadova, and today's program is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement their expertise in medical care. Their areas of specialties are in weight management, preventative medicine, and holistic health. Our guest today graduated from the University of Michigan with a bachelor's degree in cellular and molecular biology, as well as a medical degree. He completed his specialty training in ophthalmology with a subspecialty training in ophthalmic pathology and ocular inflammatory diseases at the University of Wisconsin. He is currently in a private practice in Alexandria, Virginia, and is assistant professor in the departments of ophthalmology and pathology at Georgetown University. It is an honor and pleasure for me to introduce Dr. Sina Sabeh. Dr. Sina, thank you so much for coming. I know how difficult it could be for the doctors to find the time, but thank you.
It's my honor to be here. Thank you.
So today I would like to discuss a very important topic that maybe many people struggle, cataract. So first of all, could you please tell us what is the cataract is?
Yes, one thing I've found is that cataract is a word that everyone hears, and yet when I ask them, well, do you know what this problem is? Many times they're not really sure exactly what it's dealing with. They say things like, is it a film over the eye, or is it something that you can peel off, or that kind of thing. And so for trying to explain what a cataract is, I brought this prop here to help show the audience what a cataract is. Yeah. So this is a model of an eye, and I'm going to show you how this eye works.
Right.
This eye, this is the inside of an eye, and it works very much like a camera. It has a lens in the front, and it has a film in the back.
That's right.
And so the lens of the eye is actually this area here. It sits behind the colored part of the eye, the iris. And so it works just like a lens on a camera. And for various reasons, that lens over time gets cloudy. And the most common reason is age. And many people get it. Some people get it sooner than later. It's a little bit like getting gray hair. Some families, people get them sooner, some people get them later.
So there is basically no way to avoid cataract.
If you live long enough, eventually everyone will get cataract. Yeah. And
interesting.
So, but like I said, there are factors that can lead to it. Family history of when your family tends to get them is one of them. Some people, just like some families get gray hair sooner than others, some people get cataracts in their 40s, or there are some forms of cataract where children are born with cataracts, and so the surgery has to be done when they're babies.
How could it be treated?
Well, the most common treatment for it is surgery. And but before we go to the treatment, as far as other causes for it, some people tend to get it very early on, and they wonder, well, how did I get this? There are other factors that can lead to the formation of cataract. One of them is a lot of sun exposure. So especially people who work out in the sun a lot, farmers, construction workers, those kinds of people need to protect their eyes when they're outside.
With the sunglasses.
And sunglasses are the best thing. So if you're going to wear sunglasses, make sure you get them with ultraviolet protection on it. And usually most sunglasses will say whether they have ultraviolet protection. They don't have to be super expensive glasses to do that. Even regular sunglasses, as long as they have ultraviolet protection, they are very helpful. If you can get them with protection on the sides as well, that's also helpful, because a lot of
There's a special
rays,
sunglasses that can be protected.
Yes,
from the
yes,
side
you will
as well.
see. They have some of them that, if you go to the store, you'll see that they have some that either are blocked on the sides or they have the protective lens on the side of the eyes. So those are the best kind to get. And also to wear a broad-brimmed hat, not just to protect the eyes, but also the skin of the face against a lot of sun. There are other causes of cataract formation. Some people, for example, take certain medicines, the most common one being steroids for inflammation in the eyes, and for inflammation for things like rheumatoid arthritis or lupus or other diseases in the body. These medicines can end up leading to cataract as well. So many patients who are on this medicine tend to get cataracts at a very young age. Diabetes can predispose to cataract formation. And for example, people who get diabetes, juvenile diabetes in childhood, if they don't control their blood sugar as well, they can get cataracts in their 20s. And,
oh, wow.
Yeah, so very important to keep tight control of the blood sugars. That's also a common reason for cataract formation. Injury or trauma, severe injuries to the eye can lead to cataract formation. And so all of these are various causes, but the most common one, of course, is age.
I see. How could it be treated?
The treatment for cataract is most commonly surgical. Now, many times a patient will come in and I will tell them they have a cataract. And so they say, so what are you going to do about it? And the answer is oftentimes nothing at the beginning. Just because someone has a little bit of clouding of the lens of the eye or formation of early clouding or pacification of the lens, there's no reason to jump to surgery. The time we do surgery is when it begins to bother the patient. And so a lot, and that can be very variable between patients. For example, I have patients who fly airplanes, they're pilots, and they have to land a jumbo jet with 400 people in the back at 3 a.m. with a rainstorm outside.
That's right.
And so for them, even if their vision begins to go down even a little bit, they will really feel it in their work, and it's a safety issue for them. So they need to have their cataract done very quickly. I have other patients who I check their vision and it's just very poor, and I tell them, look, Mr. Smith, you know, aren't you interested in getting this cataract out? And they tell me, nah, I'm fine, I'm watching my TV, I go for my walks, I don't need to have my surgery. So for that, we wait. And so cataract surgery is not one of those things where we need to jump on it right away. It really depends on how much it's bothering our patients. And so, you know, don't expect your doctor to make the decision immediately. It's going to have to be done in consultation with what the patient tells us as their needs are.
So basically cataract, it's something that everyone would get it, no matter how old are you. And it's like what you mentioned, it's like a gray hair, right? But so in this case, cataract could not be genetic.
Well, there are genetic components for it. No, I mean, that's not true. Just like there are genetic components for getting gray hair sooner than others. You know, again, I'm using that analogy to gray hair.
I do understand that.
So, no, there is a genetic component to it, but there's also over time. Now, there are people who are in their 90s that don't really have very significant cataracts. But what I'm saying is, if everyone waits long enough, eventually those 90-year-olds will get cataracts that are significant as well. But the older you get, the more the chance of getting the cataract. Just like the older you get, the more chance of having gray hair.
I see.
So that's how the cataracts are formed. Now, if you do cataract surgery and you remove the cloudy lens of the eye.
That's right. That's what I was about to ask.
Yeah. What happens is it's a little bit like taking the lens off a camera and not replacing it.
Artificialness.
It's going to be very fuzzy because you don't have any focus in your eyes. So it has to be replaced, and so we end up using lenses, artificial lenses. These are like contact lenses that fit inside of the eye. So it actually goes in the place of the old cataract and reestablishes focus. It used to be that these lenses that we would place in the eye were single focus lenses. So in other words, most of the time patients would want to have as best a vision as they could for distance. And then they would still need glasses for reading up close. More recently, in the last few years, there have been lenses developed that focus distance and near at the same time. And there are pluses and minuses with those. And they sound really nice. They sound like they should be a perfect silver bullet
Solution.
for getting rid of all glasses.
Right.
But there are some drawbacks to it. And the reason is that the way these lenses work, or they have worked until now, is that they have multiple focus points on the single lens. So there are rings of focus on a single lens. And when the light hits that, all the light gets broken up into distance and near focus. And so when you're looking in the distance, the near focus part of it blurs and you don't really see it very much. But then when you look up close, the distance part is blurred and you're getting both. And that works well most of the time. But as you get into low light situations, dusk or evening, as you're trying to drive and there are headlights coming at you, people tend to get halos around lights or glare around some lights. And so the quality of vision tends to not be as sharp and good as the single focus lens that we can put in. So there's no perfect solution yet. There's other technologies that are being looked at right now. For example, lenses that have a small aperture through which the light passes through. And that actually gives you a greater, what's called depth of field, meaning the depth of the amount of focus point from distance to near tends to increase. But even with that, you're decreasing the amount of light that's coming in by having a smaller aperture. So again, all of these technologies are still not 100%. Most of our cataract patients want to go back to having the kind of vision they had when they were 15 years old. And unfortunately, we're not quite there yet, but we're getting very close.
It takes time.
The technology, there's still a lot of research being done in this area. And so it's an area of active research. There are no perfect solutions. Many of these lenses that we have right now are pretty good, though. They're pretty good. We're working on it. It's still being developed. But for most of my patients, they are very happy with a single focus lens. Most of them have been used to wearing reading glasses because after age 40, we all end up needing some kind of glasses, either for near or distance anyway. So most of them are used to reading glasses. They get the best quality of vision with those single focus lenses.
They can get. Dr. Sobet, I have a last question because of the amount of time. I would love to have many more discussions with you because it's such an important topic, and I'm sure our viewers also enjoyed your health tips. This is what I wanted to ask. Is there any last, health advice to our viewers, what they can do to maybe a little bit postpone for having a cataract?
Yeah, I would say if there's one piece of advice that I would give my patients is to wear your sunglasses.
Dr. Sina, thank you so much what you shared with us today. So I'm sure with the proper choosing sunglasses and healthy food, our viewers can basically postpone for having a cataract. Thank you for joining our program. Thanks for watching us. As a reminder, today's program is sponsored by Virginia Family Medicine. Virginia Family Medicine integrates functional and alternative medicine in their practice to complement their expertise in medical care. Their areas of specialties are in weight management, preventative medicine, and holistic health. I'm your host, Mahnoujjon Mahmadova, wishing you health and prosperity. Thanks for watching us. See you next time.
Hello, my name is Dr. Kavyan Malani. This is Medical Updates. Today the topic is going to be vaccinations. There is probably a lot of debate that you have followed on the issue of vaccination of children or not, every so often there basically is some degree of a turmoil over this issue in terms of a outbreak of measles or outbreak of chickenpox someplace, and then the turmoil basically focuses on parents that do not vaccinate their children. This is a major issue. Vaccinations have been a very beneficial and very useful development in the field of medicine over the past century, and definitely we have managed to eradicate some significant diseases because of vaccination. Examples include smallpox. The polio, for example, in the US has really been limited to basically cases that were given by or transmitted by OPV, and most of the parts of the world really have been free of a lot of the very, very dangerous and virulent illnesses. The issue with vaccinations, however, is that the counter to vaccine movement, the people that are anti-vaccinations have, over the course of the past few decades, especially in the past 20 years, have made the argument that, forcefully, that vaccinations are the cause of a lot of negative things. And for example, autism and other things are mentioned as possible side effects of vaccination. The issue that we have to discuss here is, and I do want to bring this up kind of up front, is that a lot of physicians do not accommodate in any way, shape, or form parents that choose to not vaccinate, or that philosophically have a difficulty with vaccinations, or parents that have studied the issue, both sides, and out of a preponderance of caution, they have decided that they are going to wait and not vaccinate. And this is an issue because some providers, some physicians are denying medical care to these families and to these children. Basically, their health is neglected, and that there's some other aspects where the physicians can make a very important and positive change is basically ignored. I should remind physicians and my colleagues that parents that decide not to vaccinate are not basically fundamentalist, ignorant, uninformed, uneducated people. They're actually people that have studied the issue a lot, have looked at the issue a lot, have basically looked at literature, and they have chosen to not vaccinate. And at one level, this needs to be respected. The second thing that's very important is that the studies that have been done on vaccine safety are amazing, but there is a fear always that large studies and large numbers do not always basically calm our anxieties or the nervousness that a parent may have about vaccinating their one child. And so a study may have been done on 20,000 people, a Medicaid population of 6,000 people, 100,000 children, but how this one child will react to the vaccine is the cause of the immediate concern. Whereas for the medical community, basically, we're not focused on the one child, but we're focused on the health of the many. And so therefore there is a particular, really disengagement on this issue. There are two separate and divergent views of this. The medical community may say, well, for the population, this is a fantastic thing. In our large studies, there's been no increase really in these untoward effects. But on the other hand, the parent is giving the vaccine to their one child or their two children. They have kind of an immediate and real issue that they're uncomfortable with, and that needs to be basically accounted for and needs to be kind of engaged in a very positive and in actually loving manner. I myself have 3 children. I've vaccinated all 3 of them on schedule. I have no fear of vaccinations, and I think vaccinations are safe. However, I fully understand parents that come in and say, well, I have a concern. And so the approach that I've adopted in our practice is basically we sit down, we talk to patients, we review the data, we talk to parents, We review the safety of vaccines in general and some of the major issues. And usually what I try to do is I try to come up with a modified schedule that allows for kind of a safe or a safer transition to full vaccination to the extent possible before the children are due to go to kindergarten, where basically the first major deadline is going to be. In general, the most important thing to do is to hear the parents out. Usually parents have concerns, and for a physician, for a pediatric physician who basically has to see 40 patients per day, there may not be that time in the day, or even that luxury of time to sit down with a parent and actually go over the data and talk about that. But in general, that is the way to do this. In my own practice, it's been very beneficial, and all the children eventually get to full vaccination, except for it takes us some time, and we have to sometimes have a modified schedule, and that helps to get the parents on board, and that alliance between the parent and the provider and physician is really what makes this work. Anyway, so thanks for watching Virginia Medical Updates. Please feel free to contact us at 703-383-4836 or by email at virginiamedicalupdates@gmail.com. And don't forget to like and share our video on YouTube, Facebook, and Twitter.